In the 21st century, we have an ironic problem. For the first time in human history, there's lots of food to go around. Starvation isn't so much an issue as overnutrition. The problems we have today are not that we don't have enough food, but that there's too much bad food available to us. This takes a toll on everyone, particularly the poorest people in society.
Thousands of people are turning out for a traveling free clinic set up at the LA Sports Arena.
There are 2.5 million people here in Los Angeles County that don't have health insurance. Some of them are in this line tonight waiting for a free checkup. Why? Because they can't afford to pay for one.
I haven't seen a doctor in about 7 years.
I've been having a lot of problems with my feet, so
You're diabetic?
Yes.
Here we have people who can't afford health care, can't afford a doctor, can't afford their medication for diabetes or high cholesterol or hypertension or their cancer. These are people who are truly in need and whose problems clearly go back to the terrible food that's so cheap and ubiquitous. I'm someone who's been inspired by John Robbins' prayer, "May all be fed, may all be healed, may all be loved." And at EarthSave, we put a lot of thought into how we can put those words into action. And this is how the Meals for Health program was born.
A typical family is probably 4 people plus. They definitely have health-related issues, most of which happen to be related to the food that they're eating. We are in very disadvantaged neighborhoods where there's a high poverty rate, where there's a very low rate of education, where there's a lot of children that are latchkey kids, there's a lot of single parents, there's a lot of foster grandparents and grandparents in general that are raising their kids. And we roll into these communities, and the goal for us again is to create a sense of community because they don't really have one. We utilize the churches and community centers to do that, but really the focus again is to provide free groceries, healthy food to families and individuals that come from very disadvantaged backgrounds.
We're with the Sacramento Food Bank, and we're going to start a revolutionary project. We're going to take several families, maybe as many as 15 families. We're going to help them with their health and their food. We're going to help them change their lives. And by doing this, we're going to have a demonstration project to show the rest of the city, state, and country that people can fix their health problems. It's basically by changing the food.
This upcoming partnership sounds like a phenomenal opportunity for the clients that receive services at Sacramento Food Bank and Family Services, because we know that a major hurdle for a lot of families in need is food, not only access to it, but access to healthy food.
We started out as your very traditional food bank, where we were, I would say, more in the begging business, where grocery stores and individuals and farmers and can donation drives were happening, where whatever we brought in, we would pass on to our clients and families that we serve. But as time went on, we realized that we were contributing to people's health problems. We realized as an organization that our food program in particular was having a really negative effect on people from health and nutrition, and we decided to change that.
A lot of families who are in this current situation that they're in are trying to make decisions with the little money that they have. Should they be spending that on transportation to get to work, on daycare for their children, on food? And when they're in that kind of situation, that's never a pleasant one. So our organization is here to help families in need. Through
a strategic study, through a community needs assessment, we felt that we could buck traditional food banking models and begin to have more of a plant-based or a produce-centric type food program. 60% of our clientele are children under the age of 12 years old. So what we see is, obviously there's no typical client or family that we serve, but what we see is people very unhealthy. We see that their eating habits are very poor. We find that traditionally where we serve and where we help people are in food deserts, where they live nowhere near grocery stores, and we're experiencing a high rate of people with health issues. And as time goes on, we've realized through working with people like EarthSave or with the universities that one of the biggest contributing factors is the things they're putting in their mouths.
The people that we're taking care of at the food bank are people who have many obstacles in their life. And poor health is one obstacle that we can help them remove easily by teaching them a healthy diet, a diet based upon starches, vegetables, and fruits.
So the whole goal and focus of the program is really to turn families more healthy so it can trickle down to their children so they can have long lives, long healthy lives, all based on more nutrition education.
If we can take a program to people that don't have resources and show them how to get healthy, and we could have success when we have success, because we will, and we teach them how to take responsibility for their own health and not depend on medication and all of the things that we've been depending on thus far, and we could take it to this population, we can literally take this anywhere, and anyone can be helped and healed and healthier.
Looking better, feeling better through this change in diet, through rubbing shoulders with them and really treating them with dignity and respect, is the end result is that we raise people's self-esteem.
Yeah, the opportunity to work with the Food Bank of Sacramento is unique. There have been other governmental intervention programs from universities and interested dietitians and doctors, but they've always taught a program of moderation that really hasn't shown tremendous results, the kind of results that we know that the right programs can deliver. I mean, I'm talking about taking people with type 2 diabetes and curing them of their problems, getting them off medications, solving problems of artery disease and various bowel difficulties and arthritis, serious illnesses that interfere with these people's lives. And we're going to do it at a community level. We're going to do it in a neighborhood. We're going to do it with people who can spread the word themselves after they learn it to the rest of the community. We're starting a movement with the Food Bank of Sacramento.
EarthSave has assembled a team of preeminent health experts, not just to get a message of plant-based health out, but to take direct action and a hands-on approach for a 60-day intensive program through a leading food bank. The Meals for Health program is based on the type of approach John McDougall has used successfully for over 30 years. It's based on the program that Rip Esselstyn has used to whip his firefighting mates into shape, and now the rest of the country. And we're creating a template that can be used throughout the community in the United States. When you're poor financially, you can't escape your circumstances when your health is poor as well. Everyone deserves a shot. Right now, this is a one-of-a-kind program to spread a plant-based message, but we want to get it to the point where it's not unique, where everyone is doing this. And we can do that with your help.
Coming here to Sacramento today, to the Sacramento Food Bank, and listening to all of this potential and listening to Dr. McDougall talking with all of us here and planning what we're going to be doing to help these families is incredible, and it to me is a dream come true. I think this is one of the most exciting projects I have ever seen with respect to getting people to eat healthy, and it's all going to happen right now. It's all very tangible, and there's so much potential here that I can't even begin to describe it. And you could feel the energy in the room of all these people that have so much motivation to help people, and it's just all this passion and power coming together into this amazing organized way that's going to make a big difference. And I'm so excited to be a part of it and to watch it come to fruition.
We're really excited as an organization, feel very blessed that we're working with a group of people, in particular Dr. McDougall, EarthSave, Rip Esselstyn, and we have a tremendous opportunity to again buck traditional social service models, where we're actually going to walk hand in hand with people and try to change their lives dramatically by educating them and coaching them on how to become healthier by understanding what foods they're putting into their bodies, by understanding what currently they are eating and how it correlates to how they feel. And it works very close with our mission. Our mission is to serve and help people, but this really takes it to a next step. So we're very, very enthusiastic about this and can't wait to get going.